Okay, so let's talk about now the movements that are allowed by synovial joints. So all muscles are going to attach to bone or connective tissue at no fewer than 2 points. And that's because you need to have an origin, which is going to be the attachment to the immovable bone. Okay, so the bone that's not being moved. And then the insertion is going to be the attachment to the bone that's being moved by that muscle. So it's not that the bone's immovable altogether. It's just for this particular muscle, you're going to have an attachment point at the origin. And so that when that muscle contracts, it's not moving that bone. It's actually moving the other bone closer to it. Okay. So the insertion again is going to be the attachment to the bone that's being moved by that muscle. So muscle contraction causes, again, the insertion to move toward. So the bone of insertion is going to move towards the bone of origin. And this movement can occur, again, on the transverse planes, on the frontal planes, or the sagittal planes, just obviously depending upon where the muscle is attaching to and what the action of that muscle is. Okay, oops, sorry, it's not wanting to move for me there. There we go. So types of movements at synovial joints. We're going to get all different types of movements at our synovial joints. And again, it's just going to be dependent upon that particular synovial joint. So we can get gliding movements, and gliding movements occur just like this here in the wrist. When you have relatively flat bone surfaces that are going to move kind of back and forth against each other or from side to side. So this is really common in your carpals and your tarsals. Okay, you'll get the sliding movement or gliding movement. Gliding, again, sliding. Sliding is a good way to describe the gliding movements. And so again, here you can see, again, this gliding movement in the wrist. You'll see the gliding movement as well in the ankles. Angular movements, you probably are a little bit familiar with already. So angular movements are going to be when you're going to increase or decrease the angle between two articulating bones. So like, when you flex your bicep muscles, right? You're going to decrease the angle between your forearm and your upper arm. Okay, extension, so flexion is going to result in the decrease in the angle between those two articulating bones. So again, for example, when you flex your biceps, right, you're going to pull the forearm closer. So again, the radius and the ulna are going to be pulled closer to the humerus. Okay, and so you're going to decrease the angle there. Now, extension would be just the opposite, right? When you relax that and then you actually do the opposing muscle, you contract the opposing muscle, the triceps, then that's going to result in extension, and that's going to increase the angle between the humerus and the radius and the ulna. Okay, and then hyperextension, I'll show you is a continuation of extension beyond anatomical position. So that's kind of the big thing, and I'll show you that. So this would be like when you move your leg back behind you beyond anatomical position, okay? So those are kind of, we're always kind of, remember, going from anatomical position. So I'll show you this. It'll be easier to show you in some images here. So here, as you move your head down, that's flexion, okay? As you move your head back from that downward movement where you decreased again the angle between these bones, okay? And you moved your head back to anatomical position, that's extension, okay? And then hyperextension is when you extend it past anatomical position, okay? So here, for example, this is just showing you flexion and extension. So as she decreases the angle between her thigh and her lower leg here, her leg. So again, remember we use the term thigh and leg. This is where it's going to be important. So as she decreases the angle between her thigh and her leg, that is going to be flexion at the knee. Now here, as she decreases the angle between the trunk here and her thigh, this is going to be flexion at the thigh, okay? So she's flexing, and then extending as she pulls them back, okay? So I like that one to really help you kind of get flexion and extension because it's a little goofy on the leg. And then here is going to show you shoulder flexion. Okay, so there's shoulder flexion, extension, and then if he were to move it back behind him, that would be hyperextension. Okay, so there's shoulder flexion, and then extension, bringing it back to anatomical position, and hyperextension would be bringing it behind him. So these are kind of all things that you need to get familiar with, okay? So we say oftentimes, usually flexion is decreasing the angle between two bones in the anterior direction, but that's not always the case because as you saw in the knee, right? In the knee, you decrease the angle between the thigh and the leg bones by going in a posterior position. So, but for the most part, okay, for the most part, it is in the more anterior direction. So here, flexion at the thigh, this is really important. Flexion at the thigh is going to be, again, moving the leg up in this direction. And then extension at the thigh, again, is going to be moving it back to anatomical position. So this would be if you're not moving your knee at all, you're keeping it straight. Okay, again, flexion at the thigh, extension at the thigh, and then hyperextension is extending it beyond anatomical position. Okay, so do these with your own body. You know, do flexion at the thigh and tell yourself it's flexion at the thigh, then extension at the thigh, and hyperextension, because these are going to be really, really important that you know these for the muscle section and especially for the lab. So you want to go ahead and get familiar with these now. Here you can see, again, this is flexion at the knee. So as you bend your knee, you're decreasing the angle between these bones here, right? Your femur, your tibia, and your fibula. So flexion is in this direction. And then when you pull it back up, it's extension. Okay, and some of you might know this from some of, just some of your exercises that you've done in the gym. Obviously, again, flexion here. At the elbow, or flexion of the forearm. So flexion of the forearm is going to be bringing, again, your fist up, and then extension is bringing it back, again, to anatomical position. So if his arm was down by his side, back to anatomical position. And then here, again, flexion at the shoulder joint, or we would say, again, flexion of the arm. So remember here, this is considered the arm. This is considered the forearm. So if you say flexion of the forearm, this is flexion of the, I'm not going to take the time to write it in, but you can write on your notes forearm here. This one here is flexion of the arm, okay? A-R-M. Sorry, I just can't write my pencil. My pen is just so horrible to write with. So again, flexion of the arm is going to be moving, again, the arm up in this direction, more anterior. Extension is bringing it back to anatomical position. Hyperextension is beyond that. Now, keep in mind that when you're talking about your hand, remember this is from anatomical position. So remember your palms are forward. So again, flexion is going to be forward, right? In a more anterior position. That's going to be flexion, extension back to anatomical position. Hyperextension is going to be, again, backward there. So again, these movements are all really important movements that we'll talk a lot about. So we had flexion and extension. We're going to talk about abduction and adduction. So we like to say, because they sound so similar, abduction and adduction, so that you don't get confused when we say abduction, adduction, because they sound so similar. So think about abduction as abducting something away from the body. So again, especially limbs, like if you're pulling your arms out to the side, right? You're abducting, you're pulling those limbs away from the trunk of the body. So again, that's abduction. So again, any movement away from the midline, abduction. Adduction is going to be moving these limbs back or adding them back, right? Adduction, adding the limbs back to the body toward the midline, okay? And I'll show you some examples of this. And then I'll show you circumduction in just a minute, where you're going to basically do this movement of the distal end of a body part in a circle. You've done this with your arms, right? Probably some when you're doing, your exercises or whatever for your upper arms. And then the limb will basically make a cone in space. So you can do this with your arms at the shoulder joint. So I'll show you this in just a minute. So again, here's some examples of abduction, okay? So again, if you put your hands in anatomical position at your sides and you move your thumbs up away from the midline, right? Okay, this is gonna be abduction. And then adduction is gonna be adding it back to the body, okay? And then abduction is going to be spreading your fingers out because you're abducting them away from each other, and adduction is bringing them back in. And then here, again, abduction is pulling your arm away, and then bringing it back to the body is adduction, okay? So again, just a couple of old terms for you. And then abduction is pulling again that leg away from the body, okay, away from the midline, and then adduction, adding it back to that midline. And guys, I just realized, I think this is actually I'm glad I just caught this, because I'm sure this would have been confusing for you. So this is the palm up. So this is actually, these terms are, they cut this out of the new textbook, and I wonder if it was because it was incorrect. But these are actually flip-flopped. So again, abduction here would be from anatomical position. So if you were confused by that picture, sorry, I just happened to catch that. But yeah, so again, abduction is going to be from anatomical position. So if you were moving your thumbs up and away from the midline, okay, then that's abduction, abduction. And adduction would be adding it back. So I apologize, I didn't realize that that picture was incorrect, or I would have fixed it for you. Okay, so let's go ahead and, and this is just showing you, I'm gonna get to this in a minute, condyloid joints and ball and socket, but that's the next section, so don't worry about that too much. So this is a perfect example of abduction, adduction. So when you do your jumping jacks, as your arms and feet go out, that's abduction. As you bring them back to the body, that's adduction. So abduction, adduction. And then circumduction is going to be, again, this movement at the distal end of the body part where you're like making circles with your arms sticking out, or making circles with your foot, but not bending your knee or not bending your elbow. So again, you're going to kind of make these cone-like movements. So I think, I don't have a good example of that. But if you put your arms out to your side and you make circles with your hands, if you keep your arms straight, pull them, do abduction, pull them out to your side, and then make circles with your hands, little circles with your hands, that's circumduction, okay? Or again, moving your foot in a circle, keeping your knees straight, moving your foot in a circle, that's circumduction. Now, rotation, you can think of, again, rotation, just like the earth rotating around an axis. Rotation is going to be a bone revolving around its own kind of longitudinal axis, or in its own axis. And so because of that, we usually have medial rotation, which is turning, again, towards the surface or the midline, and then lateral rotation, okay? So in this case, she's doing medial rotation again as she rotates her shoulder towards the midline and brings her arm towards the midline, and then lateral rotation as she rotates at the shoulder away from the midline, okay? And so this is going to happen at ball and socket and pivot joints, but we'll kind of get to that. So examples here can be rotation between C1 and C2 as well. So remember the atlas and the axis, okay, which is going to allow you to do your no movement. So at that atlantoaxial joint, right, is going to allow you to do that no movement. That is rotation. And then a rotation of the humerus and a rotation of the femur, again, being the rotation at the shoulder joint and then the rotation at the hip joint. So I think I've got some, do I have? Yeah, here I've got some examples of the difference between circumduction versus rotation. So here would be circumduction, okay? because I feel like a lot of students have trouble with circumduction versus rotation. Circumduction is moving, a limb in a circle like this, circular cone-like movement. And then here, rotation is going to be here. I'm going to kind of go through this. See how this joint, the shoulder joint, is moving? So here, you're going to be rotating medially and now rotating laterally. So here you're going to rotate towards the midline medially and then rotating laterally, okay? So that's rotation. And you can do this also with your foot as well. So if you take your foot and you keep it, this is where I wish I could turn my camera on for you, but if you keep it straight and then you just turn your foot in as you keep your knee straight, that's medial rotation. And then now you turn your foot out, that's lateral rotation, okay? And then with the head, we just, because your head is already midline, we don't use medial and lateral rotation there. We just say rotation. Okay, extra special movements. So movement of the mandible. Obviously, this one's an easy one. Elevation, pulling it up. Depression, pulling your mandible down. So just think it all has to do with your mandible. What's happening with your mandible? Pulling it up is elevation. Pushing it down is depression. So funny, even though I'm recording this and you can't see me, I'm so used to teaching in person, I'm still like moving my mandible up and down for you. And then there's protraction and retraction of the mandible. So protraction is you're gonna push your jaw out, okay? That's protraction. And then retraction is pull it back in. Okay? Those are just some extra special movements. So there you can see protraction, and then when you pull it back in, it's retraction. All right, and then there's a couple other extra special movements. There's one that's called inversion, where you're inverting the movement of your foot medially, okay? So that you kind of turn your feet so that they face each other. And then eversion is going to be moving your foot away, okay? So the soles of the feet away from each other so that they face out. Okay, so I'll show you this in a minute. That's inversion, eversion, and then there's dorsiflexion and plantar flexion. Dorsiflexion is easier because you're just bending your foot up dorsally towards the back of your foot. And then plantar flexion, you can think of you're pointing to the plants, okay, with your toes. Point to the plants with your toes. That's plantar flexion. Okay, so here's inversion. So again, moving that so that the soles of the foot face in. Eversion, moving it so the soles of the feet face out. Do these, guys, with me while we're going through this. And then you can see here, they're going to do dorsiflexion. So dorsiflexion is pulling, again, your foot up dorsally. And then plantar flexion, take your toes and point to the plants on the ground. Plantar flexion. Okay, and then pronation and supination are these other special, again, terms that we're going to use with your hand movements. So if you take your hands and you form a bowl, okay, so you basically form a bowl upwards, that is supination because it holds the soup. Okay, so there's supination. And then if you turn your hand over, that's pronation. Okay, so again, your hands over, kind of like my husband laying flat in the prone position on the bed with his back up. Again, that's pronation. But the easiest, students always remember this as supination. Again, if you turn your hands up, your palm up, like you're holding a bowl of soup, that's supination. Okay. So it holds the soup, supination. So that's the easy way to remember that one. Let's see, and I don't know do I have an animation? I'm just going to double check really quick and make sure to see whether or not I actually have an animation with this one. I don't think I do. But here's the inversion and eversion. And the last special kind of, the last special movement that you have is something called opposition, which is just where you're bringing your thumb and your finger together. This is a unique thing, right, that we can do because we have we have this nice movable thumb, this what we call opposable thumb, right? The reason that it's termed opposition is this opposable thumb is what allows us to do our pincer grasp and pick up like Cheerios when we're a kid. This is, again, what makes us different than our dogs that don't have an opposable thumb and can't pick things up, right? So again, I always say it's nice to have an opposable thumb. It's nice to be able to do opposition, okay? That's your pincer grasp. So opposition, again, is the movement of the thumb at the carpometacarpal joint, in which the thumb moves across the palm to touch the tips of the finger on the same hand. This is basically your pincer grip, okay, in short. And so again, you can see I have there's a review of all of these movements, I think in one of the tables I have towards the end here. And then it also will tell you specifically what type of synovial joint that is. Remember that a dislocation, or oftentimes it's called a luxation, is just a displacement of that bone from a joint. Okay, so that's the term that we use, dislocation or luxation. Okay, so that's it. I'm going to go ahead and stop here, and then the last lecture will be on the different types of synovial joints.